This evening, I'm very much glad to welcome you to our presentation today. The topic we have, our facilitator is Dr. Lydiah Wambui, who is a dynamic and experienced learning and development practitioner with an established reputation for personal and organizational assessment and development, the curriculum development and implementation, and design and implementation of tailor-made learning interventions. Her objective is to enable employees to attain individual and professional growth while meeting prevailing needs for success and performance improvement within corporate environment. She has a Bachelor of Science degree in psychology and Master of Science in Management from USU, that is United States International University, and a PhD in Business Management from University of South Africa. Our topic today is Burnout as Antithesis for Work and Engagement among Researchers. I would like to take this opportunity to welcome Daktari to continue from there. Please welcome Daktari.
Thank you. Thank you, Isaiah. Thank you even for the participants. I want to take this opportunity to first thank Ida Afrique for the facilitation of the Zoom links and Zoom facilities. I also want to thank you, each one of you participants who has come, that you have taken time to actually come. I know you have a lot you could do and you have chosen to come. And so I hope it will be an effective 1 hour that you will take along with you, that it will be add on to the knowledge that you have for personal development. So with that, I think I'd like to first share, if I could share. Okay. Can everyone see my screen? Isaiah, can you see my screen?
Yeah, it is visible.
Okay. So
Yeah,
our topic this evening is burnout as an antithesis for work engagement among researchers. And burnout started off like a psychological issue. It's like attitude. But over the years and over the challenges that we have faced, and now especially in the advent of COVID, burnout has been accepted in the medical sphere as an illness. If I could start off with that.
Could you press F5 so that the slide is full, or slideshow?
I press what?
Slideshow.
Before I share.
No, even now it's okay so that we can see.
It's not allowing me.
Yes, it's there.
It's there.
Yeah, it says press from beginning. Yeah.
Okay.
Or from.
Okay. So David Packard says.
Oh, sorry, it didn't move, but it's okay. We can see it did not move.
Maybe what
after
I can
that,
do,
you select from current slide. So just there towards the left, top left. Yeah, from current slide. Yeah. Yeah, that's okay.
are you okay?
Yes, there we go. Thank you so much.
Mm-hmm. Yeah, okay. So I was saying that burnout started off as a psychological issue. And now with the advent of COVID, it has been accepted as a medical condition that is actually, the doctors are including it in their portfolio for management. David Packard said a group of people get together and exist as an institution and we call it a company. So that group of people are able to accomplish something collectively that they could not accomplish separately. They make contributions to society. This phrase sounds trite, but it's fundamental. And I want to coin it my way, that a group of people come together and exist as a country. And we call it Kenya. And so as Kenyans, we are able to accomplish something collectively that could not be accomplished separately by individuals, because every individual needs to make a contribution to the society. And because everybody needs to make a contribution, then everybody needs to know what their contribution is. If you are a marathoner and you start competing on sprinting, you might not do very well. And so it is important for individuals to identify what their areas of calling are so that they can excel in them. My study was based on the assumption that every individual on planet Earth has something they can do better than 1,000 people around you. So if you look at yourself and you tell yourself, there's something I can do better than 1,000 people around me. Now the challenge is to identify that thing. And if the challenge is to identify that thing, the process of identification requires diligence, just like a marathoner will be training, and it requires diligence, it requires hard work. Very few people are willing to input their hard work to what they are best suited for. If we go back to our education system, and I pray that with the competency-based education system, we'll have different results. Our education system does not help individuals to identify where they are better suited. In fact, if anything, we take our children to school and we tell them they have to perform in maths, they have to perform in sciences, they have to, because a parent wants to fulfill the dream they could not fulfill through their children. In the process, we lose out on the talents and abilities of children. At the workplace, you find qualified individuals, men and women who have gone through the learning system, and they have been hired because of the qualifications they have. But when it comes to performance, when it comes to excelling in performance, they are not able to excel because they are wrongly placed. Wrongly placed because they are doing the tasks that they do not identify with who they are. Wrongly placed because the organization they are working with, they do not even identify themselves with the philosophy of the organization, and therefore excellency cannot be achieved because of wrong placing. I came up with this hypothesis as a result of experience and learning. I've been an educator for a couple of years, and I have seen young people come into a university shy and not knowing what to do, and they qualify as confident people and they go back into the industry. I meet them in the streets as business executives, and I'm really proud that I am one of them who put a stone in that house. And so this evening, I want to bring it away from the workplace and bring it to research, because I believe most of us, or if not all of us, are researchers. And as we do research at the level of research, it is my belief that it is important for individuals to identify what they are good at, because then that is the only way they can excel. Okay, let's first identify research. Work, when we say work engagement, we define work as an activity involving mental, emotional, and physical activities that are done in order to achieve a purpose or result or outcome. It is also a number of workers in the economy and the effort they put in producing goods and services. And I can give multiple examples, especially with workers who produce goods and services. I believe each one of us qualifies to be a cleaner in an organization because it's the most competitive job and everybody can perform. But I will tell you from experience that there are times that a cleaner would come into the office and leave you worse off than you started, because they come in and it's like a hurricane has just passed through your office. They disarrange you, they put the papers in the wrong place, and you have now to start all over again, starting your day and putting things in the right place so that you can continue with the productivity for the day. And there is another cleaner who comes and knows how to put things in order. They will clean and there's a fresh air that comes. And so what I'm saying is, the engagement can be at all levels. It can be a top professor, it can be at the top surgeon, it can be at the base of cleaning and keeping the workplace tidy. And so we agree that the types of work are mental. So when a professor is writing a book, writing an article, reading to come up with proper lesson plans and be able to communicate the same to learners, that is mental work. Emotional is when individuals who are in human services, and in human services, human services includes hospital workers, it includes teachers, it includes anybody who gives a service to humans. I'm sure each one of you has passed through teachers, but there is a teacher, if you go back to the primary school, there is a teacher who made an impact in your life. That teacher must have been able to do the teaching profession in a manner that is different from all the other teachers. And in this evening, we are trying to say that that teacher is able to do that because okay, the slides are not moving because we are still at describing what work is. That teacher is able to teach or is able to make an impact to the learners because they like what they are doing, and because they like what they are doing.
Sorry, would you want to click on the slide so that you see if it will move? I think there was if you click on comment.
Yeah, we are talking about emotional. No.
Yeah, there you go. Now it's moving.
It is moving.
Yes.
Yeah, I'm just discussing on this particular slide that emotional labor is when a teacher uses his or her mental abilities and also communicates and links with the learner in a manner that makes impact on that learner, so that you find that learners learn the subject much better because there is that emotional connection. Physical labor is in agriculture, physical labor is in hospitals. When nurses are lifting patients, when nurses are lifting objects, it is physical labor. And so work is both, is mental, it is emotional, and it is physical. As a researcher, your work is mental, but there is also the emotional attachment to the topic that you are studying. There is the emotional attachment to your supervisors. There is the emotional attachment to the subjects you are studying, if you are collecting data from. And so research is labor, or research is work. My study was based on the assumption that every one of us has a work calling. You have something that you have been called to do. And if you identify that thing that you are called to do, you are more likely to engage in that task and less likely to suffer burnout. I focused my study on nurses. The reason I focused on nurses is that I was once a nurse and I was once a hospital administrator. And so I'm experienced from both as a practitioner and as a manager in the hospital situations. I'm sure each one of you can identify a situation where you have gone to hospital and you have met a doctor who is very qualified, but the way they treat you, you are like, okay, I think I'm not sick anymore. If this is the doctor who is going to attend to me, I'm not sick anymore. Or you have gone to a police station, or you have met a police officer, and you're wondering, oh my God, how did I end up here? Because this is not a human being. And conversely, you have entered a hospital room you have met an officer of peace, a policeman, and the way they treated you, you're like, hey, I didn't know that policemen can also be human. It's because that individual likes what they are doing. That individual feels that they are called to what they are doing. And that individual, therefore, is engaged. And that individual is very unlikely to suffer burnout. And I wanted to see how that would work out in a hospital environment. In my study, I included different interactions of the construct. So I studied 3 constructs: 1, work calling orientation, work engagement, and burnout. And I was looking at the interaction of work calling engagement with work calling orientation and work engagement, work calling orientation with burnout, work calling with the burnout, work engagement with burnout, and looking at the interaction of the subconstructs of the 3 constructs. And we will see the subconstructs of the 3 constructs. And so I was looking at the interaction. I was also looking at the mediation effect and moderation effect between the constructs and the subconstructs. I did a quantitative survey on a stratified sample of nurses who are employed by both government hospitals and private hospitals. And the reason is I wanted to see the interaction of the facilities that are provided in government institutions vis-a-vis the facilities that are provided in hospital environment, in private hospitals, and as to whether they affect the level of burnout and the level of engagement and the propensity of individuals to feel that they have been called into nursing. I also looked at the different stratas of nursing: the line nurses, the supervisors, and those with management responsibilities. I wanted to see whether, as they rise in ranks, they are able to identify themselves with the profession much better, or there are some who are in the entry position who are identifying themselves with the profession. My idea was to give recommendations to nursing professionals themselves as to how they can help employees improve their level of engagement and therefore avoid burnout, and also give a recommendation to administrators on how to modify the work conditions so that the work conditions can allow nurses from different backgrounds or diverse backgrounds to be much more effective and therefore affect the quality of service. I also wanted to give a recommendation to teachers or to recruitment process of nurses, that when they are being recruited, they can be tested for engagement levels, so that calling and engagement levels, so that those who are not called into the profession are barred from being in the profession, so that they can go into areas of their calling. I also wanted to give recommendation to employers to actually come up with programs for multi-skilling, for modifying work conditions so that individuals, although they are not called, they can change their attitudes towards the tasks and therefore improve the quality of care. I looked at nurses at different levels, as I have said, the entry, the mid, and the end career nurses, those who have line, and those who are supervising them, and the managers themselves. And in terms of the graphic representation of what I wanted to look at, I looked at the demographics, and I looked at I looked at moderation, mediating, and moderation and mediating an interaction of the construct. The results in terms of analysis, correlation analysis, work engagement negatively correlated with burnout, as we will see in terms of literature review. It correlated negatively with the burnout subdimensions of exhaustion and cynicism, but positive correlation with professional efficacy, and we will see why. Then work engagement was statistically related to the respondents' positive worldview, which is an important attribute of quality of life. And then selected demographic characteristics had partial moderation on the relationship between work engagement and burnout. And this presentation focuses on the interaction of two constructs, work engagement and burnout. Okay, in terms of results, work engagement is affected by organizational philosophy. In organizations where workers are looked as an asset, then individuals feel valued and they are more likely to engage with the organization, that they are more likely to engage with the task. They are also more likely to engage with the clients. Another aspect that I found out was that leadership style of managers and supervisors affected the levels of engagement, where managers and supervisors were democratic and they are more involving to the people under them. I found that, I found that individuals are more likely to be engaged and therefore more unlikely to suffer burnout. There were different interactions with difficult clients, especially in the hospital, and this resulted in emotional labor. And emotional labor is things like having to deal with pain. In different nurses dealing with pain among patients day in, day out seemed to wear them out. But if individuals felt that they were called to the profession, then they are able to rise up from the pain and be able to disassociate themselves. They are able to empathize instead of sympathizing. Then in terms of role conflict, individuals who felt that the role they are playing is not what they wanted, they were more likely to suffer burnout and less likely to be engaged. Role ambiguity, where individuals are not very clear of what is supposed to be performed, then they cannot make effective decisions, and that affected the quality of care. Stressful events like deaths, especially with the COVID, that really affected the professionals negatively. Heavy workload. And this, I'm sure, is in Kenya. My research was based in Namibia, and there is a mass exodus of nurses and hospital workers into the developed countries, and that leaves the healthcare institutions at home with less staff. And because there is less staff, then the ones who are left behind have heavy workload and they have work pressure, and it affects the quality of care. Some other factors that affected, that showed that they affected the motivation and performance of nurses was the autonomy, the level of autonomy, where individuals felt that they are able to make decisions at their own work level. They were more likely to be engaged and therefore more productive and provided better care. Work relationships, when there is colleague support, supervisor support, it seemed to improve the levels of engagement and levels of, and decrease the levels of burnout. Resource accessibility. This was very clear between the hospitals that are managed by private sector as compared to hospitals that are managed by the government. Then individual factors are things like personality, individual personality. There are individuals who have negative attitude towards life. When they hate a supervisor, they hate the task and they hate the clients, they hate everybody. But there are individuals who are able to separate that this is my client and it doesn't matter whether my supervisor is not nice to me, I am going to be nice to the client because I care about the client. Then leadership practices included the ability to grow. When nurses were like in a situation where they were able to identify their career path, they were more likely to be engaged and more unlikely to suffer burnout. Okay, so what is this work engagement? At the conceptualization of work engagement is a personal expression of self-role performance, where individuals express their authentic self and they are willing to invest their personal energies in tasks, in a job, in a research. That's work engagement. Work engagement also can be a lived and experienced psychological status that mediates the impact of job resources and personal resources. When you're doing research, for example, and you find that everywhere you go, you're trying to go into the websites and whatever you're looking for, you're not quite getting the information that you are looking for. It frustrates you, and because it frustrates you, it eats up on your energy and you're more likely to suffer burnout. Then personal resources is your personal, the attitude towards life. If you have a positive attitude towards life, and that comes from the positive psychology, if you have a positive attitude towards life, you are more likely to get engaged and less likely to suffer burnout. Organizational outcomes. When the organization values you, then you are less likely to suffer burnout and more likely to be engaged. But work engagement is also associated with involvement, commitment, passion, enthusiasm, absorption, focused effort, zeal, dedication, and energy. In summary, work engagement is therefore a persistent and pervasive affective and cognitive state of mind, focused on the performance of tasks within a given domain. For researchers, it is a persistent and pervasive affect and cognitive state of seeking information and knowing and learning about new ideas within your domain. So it means that whatever it is that you are studying, you must be passionate about it. If you are not passionate about your topic, very unlikely that you can excel. You will struggle through it, but it's very unlikely that you can struggle and you can excel, and you're more likely to suffer burnout. Subconstructs of work engagement. In terms of description, and I have given at the end of the presentation, I have given the references. the ones who coined up the work engagement, specifically Schaufeli and later, are the first ones to come to bring up the whole issue of engagement into the workplace. And they describe work engagement consisting of three sub-constructs. That is vega, that is a positive mood that influences the experience at work of the individual's feeling of physical strength, emotional energy, and cognitive liveliness. When you are reading something that you are interested in, you tend to have more strength and emotional energy, and you are more lively about the topic that you are reading. Dedication is a construct of workplace commitment, and in this case, is a commitment to the knowledge you are seeking to do, which is opposite of depersonalization or cynicism that is found in burnout. Absorption is being fully concentrated and happily engrossed. I don't know whether you have started reading something and then you are reading and reading and reading and you realize that time has far gone and you didn't realize, you are not even aware that time has far gone. Is because you are absorbed, and that is a sub-construct of work engagement. Burnout, on the contrary, was conceptualized by Maslach and later as opposite of engagement. In fact, the burnout antithesis looks at engagement as antithesis of burnout on a continuum, that on one side you are engaged, and the more you go to the right or to the left, whichever side you place the construct, if you are coming from the right in engagement towards left, then the more you are scoring towards left, the more you are tending towards burnout. Burnout is therefore described as a state of mental weariness in which individuals exhibit exhaustion, that is fatigue, cynicism, and cynicism is being distant and indifferent towards work, customers, and organization. So one can be indifferent towards the topic, but you can also be indifferent towards your supervisors. You can be indifferent towards your university. You can be different towards the area of whatever lab test you are doing. And then burnout, the other one is reduced professional efficacy. You can also call it inefficacy. Reduced professional inefficacy, which results in low productivity. In terms of productivity, you become more productive as a researcher because you have no confidence that you are able to actually achieve the knowledge and the outcome of the knowledge that you want. So emotional exhaustion is opposite of energy. So you feel like your energy is depleted and you are irritated. And all this depletion of energy and irritation is as a result of the work you're doing, the reading, the analysis, the data collection, the methodologies that you are using can actually lead to depletion and irritation, and therefore emotional exhaustion. Cynicism or depersonalization is interpersonal context of burnout. It is negative, callous, and excessive detachment. That this supervisor has been on your case. Every time you submit, they just bring back your paper with red ink, and they tell you what you wrote yesterday, what they told you to correct last week is what they are telling you to restore this week. As a researcher, you need to be spontaneous. You need to be supple to absorb everything, including ego, so that when your supervisor tells you to drop this and tells you to adopt it again, you're like, okay, I'll give it to you. I am going someplace, you're not going to discourage me. this cynicism is so common in human services professions. And human services professions include policemen, teachers, nurses, doctors, just human, where you need to give services to human beings. Reduced professional efficacy is lack of personal accomplishment. You find that as a soldier, for example, you are supposed to obey before you ask questions. Now, if you keep obeying and you do not see where this obeying is taking you, like you do not have career progression path, this can lead to inefficacy, where you think, this thing, I have done it for so long and I do not see where it is taking me. And so you'd start now becoming negative. And as you become negative, you're not able to excel in performance. And then you develop negative attitude, you become cynical and depersonalized. Okay, in research is work. I hope I have been able to convince you that research is work. If you never thought that research is not work, research is work. It is emotional and it is intellectual work. Research affects personal interaction with research, with personal interaction with research affects your quality of life. When you are in the process of gathering information and you are getting that information, it's juicy and it is exciting. And you're like, okay, let's go on, and you can read. And then you hit a snag and you have this person is arguing this, and this writer is arguing this, and this writer is arguing the other. What is my middle ground? How does it fit with my hypothesis? How does it fit with, how do I convince my supervisors that this is the way to go? Then it becomes strenuous, it becomes stressful, and it affects your quality of life. And more often than not, you become negative towards the people who support you, and that is immediate family. And therefore, in my philosophy, there is need for clarity of calling in the area of your study so that you can utilize your passion to excel. If I could just backtrack, if we were to come as researchers and we want to bring Kenya to the world map, like the athletes have brought Kenya to the world map, it is important for individuals to identify their areas of calling. Then you go into it, you are more likely to come up with new ideas and new methods and new ways of solving problems. And you are more passionate because you are doing the thing that you like, and you will excel. And as you excel, everybody excels, this sector excels and this sector excels. And then we put Kenya on the world map, and Kenya performs economically and socially and in terms of development. Research also requires support. To be an effective researcher, you require support. You require support from your immediate family. You require support from some friends who can support you when your supervisors are butchering you. You require some support that will keep you sustaining. You require support in a way that somebody who will tell you, now leave that and do something else, so that you can revisit that topic when you are in a better state of mind. Now, factors affecting effective research include access to information. I pray that each one of you has clear access to information for your area of calling and the passion of, and the topic of passion. I pray that each one of you is doing research in an area of relevance, that you find that this particular research is going to affect a specific community, is going to affect a specific group of people, is going to affect a specific organization. And because it's going to be relevant, then it motivates you to come up to higher standards of excellence. Another area that could frustrate you is trust. That when you have done so much and your supervisor tells you, there is no validity in this, or there is no there is no authenticity, then that can really put you aback. Another thing that can frustrate you is authority of those cited. I don't know whether you have come across your citations and your supervisors or supervisor tells you this is not an authority. You can't cite this journal, you can't cite this particular author, you can't cite this book because of XYZ. Another frustration could come from your competency in research methods. And it is therefore important for you to look for avenues of learning research methods, even from peers. Having to come to either Africa and just present and let your colleagues and your peers critique you so that you can actually be clear in your mind what research methods apply to your research, and therefore you have more confidence in presenting yourself. Another frustration can come from priority of research in the policy process. When you want to do a research in a certain area, and that particular area has policies that actually hinder you from getting information, it can be very frustrating. For example, if you want to do a study in what areas? In forensics, for example, it is very difficult for you to get information because you need hierarchy to climb hierarchy and ranks in terms of authorization for you to do that research. Finally, something that can be frustrating is accountability. Are you accountable to? When you're accountable to your supervisors, but are you accountable to your friends? Are you accountable to somebody who can tell you this? You might think that you're doing well, but it is not on. And you are able to receive that information without feeling like somebody is tearing you apart. In order to survive without burnout for research, it is my humble submission that you need to learn not to internalize failure as burnout. It's the other way around. You need to, forgive me for this, to internalize failure as burnout. You will find that there are so many times you will submit your work and there will be so much critique. Take it as criticism, not as failure. You could fail, but you are not a failure. You could fail in one thing, but you're not a failure. That doesn't define you. So don't internalize it. Another way to avoid burnout is construct ways to detach from stress. When you feel hard pressed, when you have looked for this information, when you have tried to gather this and try to add them together and they are not adding up, come up with ways of detaching from that stress for some time and revisit that issue another time when you are fresh. Prioritize and normalize conversations about mental health so that you don't end up with a breakdown. In my class, we had people who got strokes as a result of PhD study. I mean, you went in as a healthy person, now you're coming back for members of the family to look after you. Look for ways to prioritize and normalize conversations about mental health. When you are at the end of yourself, look for a person, a place where you can go, and just steam it off. You want to go into the forest, go to Karura Forest or wherever it is, shout where you're not disturbing somebody. Go and play ball, go and do something that is, steam it off, and also discuss openly that I feel like I'm at the end of myself. Help, somebody help. Then another way of avoiding burnout is to keep yourself away from isolation. Don't isolate yourself. The moment you specialize a problem that this only happens to you, you are a candidate for burnout. It doesn't only happen to you, it has happened to many people. And you will get through it. It's for a time and for a season, and you get through it. Another thing is manage your mid-career hazards. Do not change a job during your PhD or your research time, unless you have to. Don't even change houses, let alone career. Try to maintain everything else in a status quo so that you can be able to concentrate on this study and come out much more effective on that particular study and move on. At university level, I have met situations where individuals who are doing PhD, by the time they finish their PhD, the marriage is broken, or they have lost touch completely with the family. If your children are adolescents, they are in teenage, I think you'd better manage your family first before you focus on the PhD. That's my recommendation. If you can cope with it, fair enough. Avoid pile-up effects. When something is not right, address it immediately. Don't wait until it is on the 1st of July, you did this, in 2019, you did in another year, you're piling up, offenses, and that can actually affect your health, your mental health, your physical and mental health. Finally, deal with inherent problems. What are you good at? I go back. What are you good at? What is your passion? Is the topic you're studying area of passion? If it is not, I submit to you that you can look for ways of actually reorienting your study to areas of your passion. And with that, I come to the end of my study, my presentation. These are some of the authors that I have put for your reference. You could look at them. And finally, that is my contact. My name is Dr. Wambui, and I'm very keen to tell people I am doctor. Please call me doctor. I worked hard for it. I am a consultant industrial psychologist. I do career direct consultation. I consult on education, and I'm also a research mentor, and that is my ORCID address. So over to you, Isaiah, for any questions, comments, and concerns.
Wow, that was a very wonderful presentation. I welcome anybody with any question for clarification or suggestion. Please, you are welcome. Anybody with a question? I welcome anybody with a question or a comment. Ruth. Ruth Mwangi, can you ask your question? Yes, I can see Lillian is saying nice presentation. Anybody else with a please?
Maybe question, comments, or concerns?
Yes. Evelyn, Maina, do you have any question? Was the presentation okay? Then.
Oh, the presentation was okay.
Yes.
I joined me on midway. I've really enjoyed and looking forward for more presentations.
Okay. Who is that? Ruth?
Evangeline Minor.
Evangeline Minor, please. Thank you very much.
Dr. Wambui.
Yes.
My name is John Ahenda.
Yes.
I'm so grateful, especially on your suggestions on coping with the burnout. In fact, I've just related to you. That was so wonderful. I feel strong. I know I can go shout in the forest, but because I started feeling some of the things you are talking about, and your suggestions have come in so handy. So I'm so grateful to attend the meeting and I actually get that particular part. Thanks a lot.
Thank you. Thank you. Most welcome. Most welcome. My pleasure.
Anybody else, please? Dr. It seems your presentation was very nice. People don't have questions.
I hope it was clear and
Okay.
not the other way around.
It was very clear.
Okay. Okay.
Okay.
All right.
If there are no more questions, I think we should end our conversation there. We have been given a form there. We have a form there for you to fill in so that you have the presentation audio. So I'd like everybody to fill a form there for everybody to fill.
As I think everybody is feeling, Isaiah, this is Wangari. I'd like to say thank you so much for your wonderful moderation, Isaiah, and also our facilitator, Dr. Wambui. I am curious to know how researchers are actually going to apply work engagement in order to prevent burnout. How will they use the constructs in engagement as a personal resource for resilience? Because it is true, as you said, research is work. It has a duty, it has a work demand, it has a workload. And those who are more engaged actually complete. We have now a very big crisis under Commission for University Education because many postgraduate students are attritioning from the program. They're not finishing. They start, but they don't finish. And perhaps this study could be applied also in investigating the reasons for students not completing the studies that they begin. So I'm very curious to know how the members who are present today can actually have, engagement to cure the burnout, or are we saying that since the results, supported the correlation between, burnout and engagement, and both of them affect functioning, are we saying they must coexist? Are there instances where researchers can actually get rid of burnout by increasing engagement? And what is the burnout prone researcher likely to do if they cannot access that element of work engagement? So I'm more interested in the application, or how are members here able to apply? What obstacles or challenges have you had in applying? Thank you.
Okay, is that a question or a comment?
It's a question about application.
About application from my side or from the participants?
To participants.
Oh, to participants, okay. So maybe somebody can help us. You say it's a good presentation, it's encouraging. We've had one, Mr. who said that the recommendations were timely, that he had started feeling some of those signs. So maybe the person who said that could talk to us on how he is going to apply. Is he still in the house?
So who was that?
I'm not sure whether it is Colin or I'm not sure who it was, but there was somebody who said it's timely. I think it's Colin. Colin Shoko, are you still with us? Or am I pronouncing your name wrong? Colin Shoko? Mr. Ali, I can see Colin has a connection to audio, some challenges in connection to audio. Ali, would you like to comment on what you take home and what you're going to do with it, with the information? Okay, I don't see Ali. Evangeline, would you like to? Let me try the ladies. Evangeline, what are you going to do? What recommendation are you going to apply?
According to me, it's working on the things that you've talked about, the suggestions, because they will help me not to go through, to succumb to burnout. Because once you feel that you are done, you keep whatever is making you feel uncomfortable aside and try to recover, and it may take time. You might get even bored and maybe assume or even take a leave for many years before you come back to yourself. So I think it's just working on the things that you've taught us about not relocating, working on the stressors and knowing that it is normal to feel the way you feel and not to succumb to failure. That's me.
Thank you.
Yeah.
Thank you. Glorious Muhingabire, are you receiving us? Glorious.
Yes, Doc. Yes, Doc.
Are you receiving us? Tell us a point of application.
Thank you. I really enjoyed the presentation. As for me, since last year, November, I was experiencing work with that problem. My takeaway now is I have to have a plan and prioritize my activities, as well as avoid isolation. The time I went to to any social event, I feel relaxed and come up with a fresh mind. Thank you very much for the presentation. It's really helpful.
Thank you, and good research. Excel in it. Colin Shoko, you are with us. What did you say you're going to apply? And you are muted just in case you are speaking.
I think he typed in the chat.
Okay.
Thank you for the great presentation, quite encouraged. Thank you so much. So I think on that note, then we can call it a day. Really glad to have.
I have a suggestion.
Yes,
okay.
welcome.
Hi, my name is Vane.
Yes,
and I also would like to give some feedback on this presentation.
Thank you.
First of all, thank you so much. It has really enlightened me and enabled me to look at my research life in a different angle. And what came out so sharply was when you mentioned that while doing research, it is very important that we do not change our lives much. Don't change where we work, where we live, how we've been doing things. And it has made me reflect on my research and seen that actually I changed workplaces, and that totally it gave my life a totally different overhaul. And so that has really, it's like a light bulb moment to see, aha, this is actually what has changed. And previously in the work I was doing, I didn't have any role conflict. My work was automatic and natural. There were no stressful pressures that were involved. It was something that I was passionate about. So the work didn't feel as if it was work. It was just a service of labor, but and one that was pleasurable. But now I feel as if I'm role conflicted. When I wake up and as I'm going to work, it feels as though it is work. And I think that's because of some of the things that you mentioned. Is there clarity of roles that you're doing? Are you excited about the quality of work you're doing and even the interaction within the workplace? So for me, I would really like to say thank you so much.
Thank you, Ven. Thank you. If I were to be asked, even young men, please don't marry somebody. Young women, don't marry when you are doing your first finish the research and then get married, because you'll get.
Doctor, I have a little exception.
Yes.
I have a little exception, especially when it comes to changing. Like, for example, my name's John Ahenda.
Ahenda, yes.
Yes. Now I was wondering, you know me, I'm still very little. I haven't done much research, and that's why I attended this course, so that I could come out to do well. Now, I'm building a house. The house is finished. Is almost finished, and I've started this process of me doing my PhD. Yeah. Now, I'm telling myself that if that house is the way I've finished it, I want to move in there because it is a bigger house. I'm not paying rent. And at least I'll have a room to shut everybody out.
Yeah.
With what you have said, how is you tell me now, because I feel that change I'm going to have, I already spent on it. The house is finished. It's about to be finished, and it's going to be finished in the middle of my PhD. So why should I not move in there? I'll be paying no rent and I have a lot of stress.
No, I'm not being prescriptive. I'm not being prescriptive. All I'm saying is movement has its own stressors.
Okay.
But like moving into your own house, then you have less stress in terms of the money for rent. And so that is relieved. But the new environment will have its own stresses. Take it into consideration. Don't get angry about your family, and don't blame every situation to everybody else. Take it in a stride. Don't try to rush it, one day at a time. I'm not being prescriptive. I'm just saying that you should avoid major changes. But if changes are for the better, then it will help you in your research.
Thank you.
Did I respond to your? Okay.
Very well.
Okay. Thank you.
All right. On that note, I think we can call it a day. Thank you so much, everybody. And in case you're a guest, you're welcome to join Journal Club. I sent some links on the chat. in order that you can join the club. Thank you. My name is Dr. Joyce Wangare. I am the lead mentor of Journal Club, and I appreciate you all for joining the webinar today. Have a happy holiday weekend.
And
Over back to you, Dr. Wambui.
long one at that.
Yes.
It's a happy holiday, and thank you so much for Ada Afrique and even for the Journal Club. I really do appreciate your support. And yes, guys, join the Journal Club. Then you have the peer-to-peer evaluation and you have mentoring programs, and it will help you in your research. Thank you.
All right.
Oh, bye.
Yes. Welcome, Ahenda. You can.
Yeah.
Yeah.
Okay, bye.
All right. Bye. Okay.
Bye.